Stroke is one of the leading causes of death and long-term disability worldwide. Despite being common, it is a condition that many people still misunderstand or overlook until it strikes suddenly. A stroke occurs when the brain stops receiving the oxygen and nutrients it needs due to a disruption in blood flow. Within minutes, brain cells begin to die. Understanding what a stroke is and recognizing the early warning signs can truly save someone's life. In this video, we will explore what stroke is, why it happens, the early symptoms you must watch for, and how fast action can prevent permanent brain damage. A stroke occurs when the brain suddenly loses its blood supply due to an interruption in blood flow, and this event is always a medical emergency. There are two major forms of stroke. The most common, accounting for about 85% of all cases, is an ischemic stroke, which happens when a blood vessel that delivers oxygen-rich blood to the brain becomes blocked, usually by a blood clot. Once this vessel is obstructed, brain cells in the affected area begin to die within minutes because they are starved of oxygen and essential nutrients. The less common but often more severe type is a hemorrhagic stroke, responsible for around 15% of cases. This form occurs when a blood vessel inside the brain ruptures, causing internal bleeding and pressure that rapidly damages surrounding brain tissue. Although the mechanisms differ, both types of stroke can lead to permanent brain injury or death if not treated immediately. In fact, the brain loses an estimated 9 million neurons every minute during a stroke, which is why experts often refer to it as a brain attack, emphasizing the urgency of rapid recognition and treatment. Stroke does not happen randomly. It is usually the result of long-term damage to the blood vessels or underlying health conditions that gradually weaken the circulatory system. One of the most significant risk factors is high blood pressure, which puts constant strain on artery walls and is responsible for the majority of stroke cases. Over time, conditions such as diabetes and high cholesterol also contribute to plaque buildup inside the vessels, narrowing them and making it easier for clots to form. Heart problems, especially atrial fibrillation, can cause irregular heartbeats that lead to blood pooling and clot formation, which can travel to the brain and block a vital artery. Lifestyle choices, including smoking, excessive alcohol use, poor diet, and physical inactivity, further increase the risk by damaging blood vessels and raising inflammation throughout the body. Age is another important factor, as arteries naturally become stiffer and less flexible over time. Those strokes are now increasingly seen in younger adults due to stress and unhealthy habits. Genetics and family history can also play a role, making certain individuals more vulnerable. Understanding these causes is essential because most strokes can be prevented by controlling these risk factors early. The brain is an extraordinary organ that controls every function of the human body, yet it relies heavily on a constant supply of oxygen and nutrients carried through the bloodstream. Although the brain represents only about 2% of body weight, it consumes roughly 20% of the body's total oxygen, making it incredibly vulnerable when blood flow is disrupted. Even a brief interruption can have devastating consequences, because brain cells begin to malfunction within seconds and start dying within minutes. This is why stroke specialists emphasize the concept of the golden window, referring to the crucial first few hours after symptoms appear. During this period, immediate medical treatment can restore circulation, minimize brain damage, and dramatically improve a patient's chances of recovery. The longer the delay, the more irreversible the injury becomes, often resulting in long-term disability that affects speech, mobility, memory, and overall quality of life. In severe cases, prolonged loss of blood flow can lead to widespread brain death. Understanding how fast the brain deteriorates during a stroke highlights the urgent need for rapid recognition, quick response, and immediate access to emergency medical care. Recognizing the early warning signs of a stroke is crucial because timely action can dramatically change the outcome. One of the most reliable and globally recognized tools for identifying stroke symptoms is the FAST rule. The first sign is face drooping. You may notice that one side of the person's face suddenly appears uneven or droops when they smile. The second sign is arm weakness. Ask the person to raise both arms. And if one arm drifts downward or feels numb, it may indicate a stroke. The third sign is speech difficulty. Listen for slurred words, confusion, or trouble forming even simple sentences. These three symptoms alone can signal a major medical emergency. If any of them appear, the final step, time, becomes critical. It means you must call emergency services immediately without waiting to see if the symptoms improve. Stroke symptoms can progress rapidly, and every minute of delay leads to more brain cells dying. Acting quickly not only increases the chance of survival, but also reduces the severity of long-term disability. Learning and remembering the FAST rule empowers anyone to respond effectively during a life-threatening situation. While the FAST rule helps identify the most common signs of a stroke, there are several additional symptoms that should never be overlooked, as they may appear alone or in combination. One of the most alarming is a sudden, severe headache, often described as the worst headache of a person's life, which can signal a hemorrhagic stroke. Another critical symptom is sudden confusion or difficulty understanding speech, where the individual may appear disoriented or unable to process simple instructions. Vision problems, such as sudden blurred or double vision, or the loss of vision in one eye, can also indicate damage to specific areas of the brain. Many stroke victims experience dizziness, loss of balance, or difficulty walking, which may cause them to stumble or collapse unexpectedly. Numbness or weakness on one side of the body, affecting the face, arms, or legs, is another key indicator. In some cases, individuals may also struggle with swallowing or suddenly lose consciousness. Because these symptoms develop rapidly and without warning, recognizing them and seeking emergency help immediately is essential. Ignoring or misinterpreting these warning signs can result in severe brain injury or even death. A transient ischemic attack, commonly known as a TIA or mini stroke, is a temporary blockage of blood flow to the brain that causes stroke-like symptoms, but typically lasts only a few minutes. Because the symptoms disappear quickly, many people ignore a TIA or mistake it for fatigue, stress, or a moment of dizziness. However, a TIA should never be taken lightly, as it is one of the strongest predictors of a future major stroke. Studies show that up to 1/3 of individuals who experience a TIA will suffer a full stroke within the following year, with the highest risk occurring in the first 48 hours. During a TIA, the brain receives a brief warning signal that something is wrong, such as a clot passing through a vessel or a temporary drop in blood supply. Even though no permanent damage is done, the underlying cause remains. Recognizing a TIA and seeking immediate medical attention allow doctors to identify risk factors, begin treatment early, and prevent a devastating stroke from occurring. Treating a TIA as a genuine emergency could be the difference between recovery and long-term disability. When you suspect that someone is having a stroke, the most important action is to respond quickly and decisively. The very first step is to call emergency services immediately, because professional medical teams can begin assessment and treatment on the way to the hospital. Do not give the person food, water, or medication, as they may have difficulty swallowing, which could lead to choking. It is also important not to let them fall asleep or lie down in a position that makes breathing harder. Keep the individual calm, reassure them, and help them stay in a safe sitting or lying position while waiting for help. If you know when the symptoms started, note the exact time, because this information determines which treatments the hospital can safely provide. Avoid driving the person yourself unless absolutely necessary. Ambulances are equipped to handle stroke emergencies and can transport the patient faster and more safely. Do not attempt home remedies or wait to see if symptoms disappear on their own. Every minute counts, and a rapid response can significantly reduce the damage to the brain and improve the chances of recovery. Stroke treatment focuses on restoring blood flow to the brain as quickly as possible, or controlling bleeding to prevent further damage, depending on the type of stroke. For ischemic stroke, which occurs when a blood vessel is blocked, doctors may use clot-dissolving medication known as thrombolytics. These medications are most effective when administered within the first 3 to 5 hours after symptoms begin, making rapid arrival at a stroke-ready hospital critical. In more severe cases, a procedure called mechanical thrombectomy may be performed, in which a specialist inserts a tiny device into the blocked artery to physically remove the clot. For hemorrhagic stroke, where a blood vessel ruptures, treatment focuses on controlling bleeding, lowering dangerous blood pressure levels, and sometimes performing surgery to relieve pressure inside the skull. The effectiveness of all these treatments decreases sharply with time because prolonged loss of blood flow kills millions of neurons each minute. This is why stroke specialists repeat the phrase "time is brain," emphasizing that immediate action can make the difference between full recovery, permanent disability, or death. Early intervention offers the best chance for survival and long-term brain function. Although stroke is a sudden and often devastating event, the encouraging truth is that up to 80% of strokes are preventable through proactive lifestyle choices and proper medical care. One of the most important preventive strategies is managing high blood pressure, the leading cause of stroke worldwide. Regularly monitoring blood pressure and following medical advice can significantly reduce risk. Maintaining healthy blood sugar and cholesterol levels is equally essential, as diabetes and high cholesterol contribute to artery damage and clot formation. A balanced diet rich in fruits, vegetables, whole grains, and lean proteins supports vascular health, while reducing salt, sugar, and unhealthy fats helps protect the arteries. Physical activity, even as simple as walking 30 minutes a day, improves circulation and supports heart function. Avoiding smoking and limiting alcohol consumption further lowers the risk by preventing inflammation and blood vessel damage. Keeping a healthy weight, managing stress, and getting regular medical checkups, especially for older adults, are also key components of stroke prevention. Small daily habits, when maintained consistently, can dramatically reduce the chances of experiencing a stroke later in life. Stroke is one of the most urgent medical emergencies a person can face, yet it is also one of the most misunderstood. Many people fail to recognize the early warning signs or hesitate to seek help quickly, which leads to preventable disability and death. Understanding how stroke develops, knowing the fast symptoms, and taking immediate action can dramatically change the outcome. The difference between full recovery and permanent brain damage often depends on how quickly someone receives treatment. Stroke does not discriminate. It can affect young adults, older individuals, people with chronic conditions, and even those who appear healthy. That is why awareness is not only a medical issue, but a community responsibility. By learning the signs, encouraging loved ones to manage risk factors, and maintaining a healthy lifestyle, each of us can contribute to preventing stroke before it happens. Remember that every minute matters. When a stroke occurs, hesitation can cost precious brain cells, while fast action can save a life. The more we understand, the better prepared we are to protect ourselves and those we care about from one of the world's most serious health threats.